Good morning, friends. Today we will be going to discuss about ECG interpretation. That on exam, how we can find that which pathology is associated with the patient. First of all, I want to give you a basic idea of heart functions. As we know, there are five basic functions of heart: automatism, excitability, conduction, contractility, and refraction. So these are the five basic functions of heart. You must know about them. Then we know when we do ECG, we have some leads, some limb leads and some chest leads. So whenever you go to the ECG, you see the patient arms with red color ECD in the right hand, yellow color lead in the left hand, and green color lead in the left leg of patient, and black color lead in the right leg of patient. And black color lead does not have any function on ECG record. It helps as a ground electrode to prevent any electrical trauma of patient. Then we know about chest electrodes. They are alongs the intercostal space. We have six along the right external margin, then along the left external margin, and then para-external, middle clavicular, anterior axillary, and mid-axillary line. First of all, the electrode is placed as fourth intercostal space and then to the fifth intercostal. So, as you can see, the normal ECG first of all contain waves. As we can see here, we have P wave and T wave. Then the second component of ECG is intervals. So we have four intervals. First one is PR interval, then we have QT interval, then we have QRS interval, and then we have RR interval. We cannot see here RR interval because it's single interpretation. If complete, then you can see next contraction and relaxation of heart, and there will be RR interval. And then we have segments like ST segments and TP segment. After T, again there will be P wave, and that is called TP segment. And both segments are isoelectric line. Now, the main question is about how you will answer on ECG during your exam. So you need to answer basic five questions, that the ECG is sinus or non-sinus, regular or irregular, the heart rate means the patient have tachycardia or bradycardia and may be associated with other pathologies. You need to answer about position of electrical axis and different syndrome, like what is our conclusion. Rhythm disorder, is sinus tachycardia, it is sinus bradycardia. And conduction, what does it mean? Conduction disorder means it is atrioventricular block, it is intraventricular block and bundle of his block. Then hypertrophy, is it right ventricular hypertrophy or left ventricular hypertrophy, or maybe atrium hypertrophy. And dystrophy, dystrophy is when the muscles of heart become weak. Now this is the basic idea on the affection of lead. Like on ECG we see problem with fast standard and AVL. What we can conclude, that it is a problem with the left ventricle, and if we find the second and AVF, then left ventricle but posterior wall. Like this, we can interpret the exact location of the pathology, like where it is included. Like in V4, it is at the apex of heart, and in V1 and V2, it is at right ventricles. So you must have basic idea. If you know these, then you can easily tell to the examiner that where is the exact location of the pathology. It is in the left ventricle, or it is in the right ventricular, or it is at the base or apex of heart. Now, as I already told you, we need to discuss about the rhythm. Is it sinus or non-sinus? Is it regular or irregular? On exam, you will start step by step. Your first answer to the examiner must be about rhythm. Is it sinus or non-sinus? Regular or irregular? How you will find on ECG? Is it sinus or non-sinus? Regular or irregular? So, when you will see the ECG, you must start from second standard lead. If P wave is positive and it appears before Q wave, then your conclusion must be rhythm is sinus. So when you can say the rhythm is sinus, we can say the rhythm is sinus when we can see P wave is positive and it is always before Q wave, and it means the impulse start from sinoatrial node. Let's see by the help of ECG. Like I already told you, we must start from second standard lead. And in second standard lead, we see the P wave before QRS complex. Means it is positive P wave. When positive P wave indicate rhythm sinus. But if it is deformed, then we are talking about non-sinus. As you can see on second standard lead, P wave is positive and before Q wave. So when P wave is positive before Q wave, then we are talking about sinus rhythm. But when P wave is negative, like in the first ECG, we can see the P wave is positive and before Q wave. So we are talking about sinus rhythm. But in the second and last ECG, we can see P wave is negative. If P wave is negative, so it means it is non-sinus. And in the last, we can say P wave after QRS complex. And P wave must be before QRS complex, not after. Then our next point is measuring of heart rate, means evaluation of heart rate. To find the heart rate, we must measure RR interval. If the length of all RR interval in all the leads is same, then we can say our conclusion that it is regular. But if it is irregular, then we must find average for 5 RR intervals and then say it is irregular, and then we will find the conclusion after irregular. It is cardia or bradycardia. To find the heart rate, we have the simple formula 60 divided by RR interval in seconds. As I already told you, we measure distance in millimeters. So our RR interval that you will measure will be in millimeters. But formula requires it in second. So how you will convert this? Now I will give you a basic idea regarding this scheme. Mainly, our 90% of ECG are recorded at a speed of 25 mm per second. So if it is at 25 mm per second, so you must multiply the average R interval by 0.04 and your RR interval will be in second. our ECG is recorded at 50 millimeter per second, then we must multiply by 0.02 second. It is the simple unitary method. If it is 100 millimeter per second, then we will multiply by 0.01 second. Like for example, if we have 15 millimeter average of our interval, then we will multiply it by 0.04. Our RR interval in seconds will be zero point 0.6 second, and when we will divide 60 by zero point 0.6, then our cardiac rate will be 100 beat per minute. And we know if cardiac rate is 100 beat per minute, then this is the condition for tachycardia. As we can see on this different RR interval, so we can see on ECG in the below ECG that we have different RR intervals. The most common mistake of the students on exam, instead of counting 5 RR interval, they count 5 QRS complex. If you will count 5 QRS complex, then it will be 4 RR interval, not 5 RR interval. So you must open your eyes and brain and you must count 5 RR interval instead of counting 5 QRS complex. It is the most common mistake by student on exam. And in the above ECG, we can see equal RR interval. So we can say our rhythm is regular. But in the below ECG, the patient is suffering from tachycardia with irregular rhythm. But it is sinus because before QRS complex, QRS complex and Q wave, we can see positive P wave, and it is the indication for sinus rhythm. Then, according to the scheme, our next task is to find the position of electrical. The position of electrical axis may be physiological and may be pathological. So, in the physiological, we have three axes: normal axis, horizontal axis, and vertical axis. While in case of pathological, either axis deviate to the left or either axis deviate to the right. How we can say axis deviate to the left and axis deviate to the right? So, on ECG, when we will see deep as wave in first standard lead, so we can say electrical axis deviate to the right, and deep S1 wave in first standard lead is associated with high amplitude of R wave in third standard lead. So we can say for the electrical axis deviation to the right we have S1R3, and it is also the indication for hypertrophy of right ventricle. And if on ECG examination we see high amplitude of R1 in first standard lead and deep as wave in third standard lead, so we can say the condition is R1S3 and electrical axis deviate to the left, and this is the condition for left ventricle hypertrophy. Why it is necessary? Because to find it is physiological and pathological, first of all, we must find deep S wave. If there is no deep S wave, then we can say any physiological axis. Maybe it's normal, maybe it's horizontal, and maybe it's vertical. Let's differentiate how we can say it is normal, horizontal and vertical. If on ECG examination you see high amplitude of R wave in second standard lead, then we can say about normal. But if we see high amplitude of R wave in first standard lead, then we can say about horizontal, as you can see on diagram. And if R3 is high in third standard lead, then we can say about vertical position. But you must remember, R2 is always greater than R2 and R3 in normal condition. And in case of horizontal, you can write conclusion like this: R1 is greater than R2 and R2 is greater than R3. Always R2 must be greater than R3 in case of horizontal position. But in case of vertical position, R3 will be greater and R2 more than R1. And we also have another condition that R3 is bigger than R1 but not more than R2. It is also the condition for vertical position. Now we will do analysis of interval. I already told you, based on the speed of ECG, we must multiply the length of counting millimeter by the respective 0.04 and 0.02. If PQ interval is more than zero point 0.2 second, then we can say about atrioventricular block. And if QRS interval is more than zero point 0.1 second, then we can say about intraventricular block. QT interval is more than 0.44 second, then we can say about dystrophic activity, and it is the consequences of heart failure. As we can see here in the third standard lead, Q wave amplitude is more than 0.44 seconds, then it is dystrophic activity of heart. Next, the final step is the analysis of waves, ST segment and voltage. The normal P wave is rounded, but P wave millimeter is 1.5 to 2.5. If P wave is increased in first standard lead, then we can say about left atrium hypertrophy, and we will see the P wave become wide and high in amplitude. And if it is increased in second and third standard lead, then we can say about right atrium hypertrophy. So we can easily differentiate between right atrium hypertrophy and left atrium hypertrophy on the basis of P wave amplitude. Then Q wave. If Q wave is more than 0.03, then it is myocardial infarction. The next wave is R wave. R wave, it is the most important wave in ECG interpretation because it represents contraction, and if there will be flat R wave means death of patient. And in the first, second and third standard lead, we will measure the amplitude of R wave, and if it is more than 15 millimeter, then we can say the voltage is capped. And if S wave is 2.5 millimeter, it is the normal value of S wave. But I already told you about pathologies regarding S wave. If it is deep in first standard lead, then it will be right axis deviation and hypertrophy of right ventricle. And if it is deep in S3, means third standard lead, then it will be hypertrophy of left ventricle. Then we talk about G wave. G wave is generally flat wave, widen negative indication for pathology. Generally, G wave is round and asymmetric, and it not max than 1 by 2 of a wave. It is the period when myofibril prepare to next contraction, and it gives us indication about repolarization. If you see any flat T wave, you see widening or negative T wave, then you can say about disturbed repolarization. It also tells us about myocardiopathy, myocardial infarction. If T wave is sharp and symmetrical, then we can say about myocardial infarction. Like in V6, we can see it is sharp and symmetrical. So it is myocardial infarction. So this is the all information which I want to give around ECG interpretation. Maybe some one or two pathologies remaining like extrasystole, extrasystole, paroxysmal tachycardia. So it's very short information. Next video will be very short and in length. I will explain you regarding that syndrome, and we will also see some examples of ECG. So today I want to finish with this ST segment. So ST segment is a isoelectric line. It is the more grave condition when there is the elevation of the ST segment instead of depression of segment, and it gives us information about acute myocardial infarction. If you see on ECG that ST segment is elevated, so you can close your eyes and clearly say about acute myocardial infarction. Now, today I want to stop with this ECG interpretation. Now, what we have discussed, I already told you on ECG interpretation, you must answer about rhythm. Is it sinus or non-sinus? Regular or irregular? You say about heart rate. You say about voltage capped. And you must say about vertical position. And how you will differentiate vertical position? First of all, we will see for any pathological wave. If there is no pathological S wave, then we will try to find the normal position or vertical position or horizontal position, means physiological position. As we can see here, there is absence of P wave before Q wave in second standard lead, because I already told you we must start our interpretation from second standard lead. So we can say there is no P wave before Q wave, so it is non-sinus. But RR interval are same, so it is regular. And heart rate I find that is 74 beat per minute. And we can see that it is about 5, because one block represents 5 millimeter. It is about 10 and it is around 8. So more than 15 millimeter. Our conclusion must be voltage is capped. We cannot find any pathological S wave. So now we will find the electrical axis position. As we can see, R2 is highest, and I told you if R2 is highest, so your conclusion must be vertical position of electrical axis. R2 is greater than R3 and R1. Normally R2, if bigger, then we are talking about normal position. But I told you if R If R3 is more than R1, then it is the condition for vertical position. So our conclusion is non-sinus regular voltage kept R2 is greater than R3 and R3 is greater than R1. So position of electrical axis is vertical and we don't find any pathology. So I want to stop with this. Thank you very much. Goodbye.